Okay, sorry about that. So the last thing that I really want to go over is the community treatment order. So this is something that someone who is voluntary or involuntary can be released on, and once you have a CTO put in place, all of your other certificates get canceled. So they're not going to be like held in the facility anymore, and that's kind of what patients see as the major benefit of the CTO. So in order to have a CTO, two physicians, one of them needs to be a psychiatrist, issues this community treatment order. And to be placed on a community treatment order, the physicians need to believe A, that the person's suffering from a mental disorder, and then B, one or more of the following three conditions apply. So number one is that they've been submitted or admitted to the hospital in the last 3 years on 2 or more occasions or for a total of at least 30 days. And this means that they've been a formal patient in a facility, or they've been in a hospital or an institution where it's evident that they would have met the criteria to be detained. So even if they're voluntary, if they are looking like they're going to be a risk to themselves or others, that would still fall under that section. The second option would be that the person's had the preceding 3-year period, they've had a CTO at that time. Or the person has, while living in a community, exhibited a pattern of recurrent or repetitive behavior that indicates that they're likely to cause harm to themselves or others, or suffer substantial mental or physical deterioration. So again, kind of the same things that would qualify them for a Form 1. So basically, they would need to sign the form for that, and then the person needs to be willing to consent to the CTO, or the circumstances are such that consent is not needed. So you can read a little bit more about that in the Alberta Health Services Guide. I know it's like 200 pages, but they have really good flowcharts. So if anything in here has seemed confusing, you can always hit up the flowcharts, and they'll give you a little bit more information. It gives you kind of a step-by-step guideline of what's going to happen for both getting certified and getting a CTO. So hopefully that was helpful. Other than that, if you have any questions or if anything needs to be clarified, probably talk to one of the instructors. Okay?